Modified irrigation tip for bimanual IA.
In flax, the rex's size or the height of the resection can be adjusted. We normally keep it at 600 microns, so it's 400 microns above and 200 microns below the anterior capsule. Post-flax, to perform bimanual IA in a well-dilated pupil, one can easily hold the cortical matter just below the margin of the anterior capsule and aspirate the cortex. Let's look at a case of flax in a very hard cataract. During phacoemulsification, the pupil constricts below the margin of the CCC. So now the problem begins. Here we are using the irrigating cannula to hold the constricted iris away, but due to poor grip, it keeps slipping and makes it difficult to do cortical aspiration. Look at the struggle, and the iris keeps slipping. So we invented the irrigating Y. To the irrigating handle, we attached an attachment like a Y, and this attachment actually helps to hold the iris away. With the aspirating port, we can go beneath the margin of the CCC, hold the edge of the cortex and aspirate it. The design of the irrigating Y is in such a fashion that the PC is kept away because of the flow. The procedure continues. Again, the iris is held with the Y portion of the irrigating handle and the cortex is easily aspirated. With change of hands, the procedure is repeated, iris is gently retracted, the anterior capsule margin is visualized and the cortex is aspirated. In conclusion, the irrigating Y is a very useful instrument for an atraumatic retraction of the iris and aspiration of the cortical matter by avoiding the use of iris hooks in a non-dilating pupil or an intra-op miosis. Alternative uses are feeding the aspirating port, residual cortical aspiration after IOL implantation, facilitates hydroimplantation of IOL to guide the leading haptic into the bag, help to lift the IOL, support it and clear the viscoelastic from behind the IOL, maintaining toric alignment by pressure on the IOL during viscoelastic removal.
So it's 2-in-1.
Thank you, sir.
Any comment?
No, we just, this was an incident where we were having a myotic pupil after a flax case. So retracting the iris, it was a floppy iris, but then retracting became difficult. It came to the size of the rexis itself. So then we had to use a Y and then keep injecting viscoelastic. So we thought of this as an instrument which can maintain the chamber as well.
Yeah, nice actual innovation. I think we should take really tip from you that sometimes with a very bad iris, I think this really helps. Yeah.
It's available otherwise commercially? Or?
Yes, it's available with
Yeah,
Epsilon.
if Kumar would have been come, means definitely it would have been one of the topmost runner for the champion. Mohan is really feeling very happy that his contender is not there here.